Good day, everyone. Welcome. My name is Cornay Smith. I'm a dentist in private practice in Cape Town in South Africa. I had the pleasure of helping two people today, two emergencies during the COVID-19 lockdown in South Africa. So at the moment we are under lockdown. It is Tuesday, the 31st of March, and it is day 4, day 5. I don't know. But the point is, we are under lockdown and we're only allowed to see emergency patients. We're not allowed to do any elective procedures at the moment. So I thought it would be helpful or useful to just give you guys some feedback on my experience today, because it was quite a steep learning curve to get all of these processes and protocols in place to be able to see these two patients today. So first of all, since today's Tuesday and since the lockdown on Thursday, we set up a centralized emergency screening system through our receptionist. So she's got a WhatsApp phone with her, and she's also attending our emails. So on our answering machine, we are directing patients to send us WhatsApps or emails with automated responses and all kinds of information. But the point is, she's screening the patients. And then after her screening, she then sends. So at the moment, I'm on call. We divided the practice into teams. Jean, my partner, he has his team, and I've got my team. And we decided to try and separate ourselves as far as possible. I'm on call until tonight, 12 o'clock, and then it's Jean's turn, and he'll be working on Friday. So yes, getting back to the screening process, the receptionist would then give me the details of the patients that she thought was necessary to contact. And throughout the past couple of days, I actually spoke to a couple of patients, about 6 or 7 patients, and some of them I had to speak to more than once. So we are following the protocol set out by the CDC, by the ADA, by SADA, by all the bodies that have that we believe are worth following. And so the triple A's is a nice way of looking at things. It's advice, analgesics, and antibiotics, and that's the way that you can start screening patients already by using that formula. And we got a really nice information brochure from the American Association of Endodontists, and they've got like a little flow chart where you can really go into the details of what is advice, what is analgesics, and what is antibiotics, or when what any of those things would be needed. So I think my mic is a bit sensitive. I'm hearing a lot of feedback. Anyways, so yes, I screened the patients, and we did then see the need to see 2 of them. After asking a whole bunch of questions, it was quite clear that these 2 patients were in positions where we were not able to extend or postpone their treatment for 30 days. And that's part of the guidelines that we got from the South African Dental Association. Anything that you're not able to postpone for 30 days is deemed as an emergency. The one patient was in acute pain. I suspected either an extraction or an emergency root canal treatment that would be needed. And the other patient had a loose implant bridge that was causing a lot of discomfort. It was an old implant that we're trying to save, and it was a temporary implant bridge. A long story. The point is, it's an existing patient that I know quite well, and she was due for replacement of this temporary implant bridge. We were trying to nurse these implants to be able to put a new permanent bridge on if everything was going well there. But she was due to have this replaced with a permanent bridge anytime now. And unfortunately, this bridge started coming undone. I also suspect that it might have been due to intubation. She had a baby 10 days ago. So the patient was in hospital 10 days ago with having a baby. I mean, it's just crazy. And that the fact that she has an infant, a newborn baby at home, really made me think twice about even seeing her. So I had to think very carefully about the risk factors and what I'm potentially exposing her little baby to. Even though we know that yes, kids and are not really at risk with COVID-19. I did not want to take a chance of exposing this little 10-day-old baby to any viruses. So it just brought home the seriousness of the situation. So just to come back to the screening process, yes, we got these patients in, and I want to run you through the actual practicalities of how we saw the patient and what we had to do to make sure that it was safe. So the patient arrived at the practice. They waited in their car. She sent me a WhatsApp to say that she was ready. When I left my house, I I left in one set of clothes and shoes, and I also took with me another separate set of clothes and shoes, and when I got to the practice, we have a little separate area there that we put aside. We've prepared this for getting dressed. So I took my shoes off outside of the practice, put a clean set of shoes on that so we don't bring any germs in that way. I got dressed in a separate set of clothes. And then, together with my assistant, she did exactly the same. So we started cleaning the practice and we started preparing 2 rooms. So we're fortunate enough to have several rooms in the practice. So we were able to prepare 2 rooms for these 2 procedures. The one room we knew we were going to need some implant compound tools and stuff. And the other room we knew we were going to probably do an emergency root canal treatment. So we were able to prepare both of the rooms without having to scuttle and look for stuff and have to go out of the rooms while we're doing the procedure. So at the time that the patient arrived at the practice, she was waiting in her car for me to let her know that we were ready. At which point she was greeted at the door by the assistant. The assistant just had a mask on and her scrubs at that time. And the assistant then we also obviously asked the patient to leave her handbag and everything else in the car. And the patient was asked to not bring anyone with her. So she could it was only the patient that was allowed to come. And on that note, with traveling, we had to send her a notice, a letter to say that she was allowed to travel. And I actually was stopped when I was on my way to the practice. I was stopped in a roadblock, and I had to show my HPCSA card and everything to show that I was able to come to the practice. So I didn't expect to be in a roadblock, but they were very strict and they really looked at all my details and information. So just on that point, it is important to give your patient traveling documents and to make sure that your assistant's documents are all up to date and legal. So the patient came in. If she still had her phone or wallet or anything with her, we had a little Ziploc bag prepared that we would be able to put that in. There was then hand sanitizer offered to her, and she was immediately directed to the surgery. At the surgery, we asked the patient to wash her hands. So we had a really good hand wash there available for her. And then we also have a hydrogen peroxide mouthwash that we asked the patient to rinse with, which has been, it seems like, proven to reduce the viral load in the patient's mouth. That helps. We don't really know, but we're trying to do everything we possibly can. The patient was then asked to be seated in the dental chair and not to touch anything. So at that stage, I got dressed in a separate room. I followed the full protocol of one set of gloves and then putting on a gown, putting on a mask, putting on a second mask, putting on my glasses and my visor. And then I went to the room. At that stage, I sterilized, or not sterilized, I used hand sanitizer, alcohol to clean my gloves, and I put on another set of gloves. And I then spoke to the patient and got a history again. It was, and just actually, I just asked about her newborn baby. I was very curious whether it was a boy or girl. I don't think they knew beforehand. So we actually just spoke about her baby. But the point is, we had a little bit of a conversation, and which gave the nurse time to also get dressed in her gown and her full PPE gear, what we had. And then we put the patient in the correct position. We did the procedure. We did the treatment. So I was able to put the bridge back, and to also make sure that everything was nice and clean. It was really hurting her because yeah, it was. So we really were doing this patient a great favor by getting this thing put in correctly again. And after the procedure, I mean, it's ridiculous. It took me like 20, 30 minutes, maybe 35 minutes to do the whole thing. And afterwards, the patient was then asked to wait in a specific chair that we put out, which was a chair that we would be able to clean afterwards. And the chair was obviously cleaned before the time, and to wait for us. I took off my first set of gloves, and I took off my visor and my glasses, my outer mask, and then we started cleaning the chair. And my assistant also took off all. She actually took off her gown and everything. So we did this in the full order. What's full order? In the sequence that we discussed beforehand. And the assistant went out and she took the payment from the patient. So we've got like a little snap scan thing that you can just scan, so everything is no touch. Or if you want to pay with your credit card machine, then we wrap the credit card machine in cling wrap. So all of that was done, and the patient was then fine, and she was sent out and on her merry way. At which time we were basically ready for the next patient in the second surgery, which was also set up already. And we phoned the patient to tell her that we were able to see her, and she was greeted at the door exactly the same thing. She needed an emergency root canal treatment, and I think it was very useful for us to have 2 rooms set up. Otherwise, it would have taken forever to clean in between the 2 procedures. So the second room was used then for the emergency root canal treatment, and we followed exactly the same protocol. After both of these patients were treated, it took us like an hour and a half or longer. I can't even remember exactly how long, but it took us a really long time to clean everything again. We had everything wrapped in cling wrap. It actually looks ridiculous, but everything that you could potentially touch was wrapped in cling wrap. I think it's like it serves a purpose of making sure that everything's clean, but also to be mindful of what you're touching. And it also just gives the patient some peace of mind. Something that was quite interesting was I was really concerned. I mean, I came in there with like a cap, and it looked like I was going to theater. I think I looked a bit weird, but and as I approached the patient, and I remember this is now a patient that I know quite well, and she's been a part of the practice for a very long time. So I felt a bit awkward when I saw the patient, and she was just so grateful. She was so grateful for the fact that we were taking all of these precautions for her. And the same with the second patient, who didn't even know me from a bar of soap. I mean, she probably wouldn't even recognize me if she saw me in the shopping center afterwards, because I had 50 masks and 50 glasses and everything on. So there's no ways that she never saw my face. But she was also equally so grateful. And people are already scared of the dentist. So I was concerned with the fact that we're looking even more scary now. But I think because people are so scared, they really appreciate the fact that we're taking extra precautions, which was, afterwards, looking back now, that gave me just some peace of mind to know that people are actually appreciative of the fact that we're doing this. And it takes so much time. So for these two patients, I mean, I didn't really, financially, we can't really go into it's, this is a service that we're providing for people. We're doing this to make sure that people don't have any other problems that would lead to them having to go to emergency rooms. We're just really trying to take the load off emergency rooms at this stage. That's why we are doing this. But I was there from 10 o'clock to about 2:30, cleaning everything. And yeah, that was a lot of time spent on just two relatively short procedures. But that is what it has, that's what it's come down to. After these procedures, we made sure we prepped for the next team. So the next team will be going in on Friday. So Jean's team is up for, they're on call now, which just gives, I think we're giving the two teams a bit of time to take a breather in between. And it's also, I think it's safer if we have the practice just standing, just being closed for, the 2 days in between, not to have people in and out all the time. So after everything was clean and we were happy, I got dressed in my other clothes again. And when I got home, I just threw the set of clothes that I worked in. And I mean, I did have a gown on as well, but just to be extra safe, I put those clothes in the washing machine immediately. And then obviously you want to take a shower and you just want to you want to be as clean as possible when you in your house again. You don't want to bring in any bugs after you've been outside. Um, yes, so this is what my experience was like. It was massive learning curve. It took me forever. I had to think a million times about everything I was doing. And it would be interesting to know what you guys think of what we did. Do you think we did anything? We missed anything? Any advice? Any suggestions? The one thing I do think we could have probably done differently, thinking back now, is the fact that we didn't take the patient's temperature. I know some of the clinics worldwide are doing that. They are taking patients' temperatures, but we really just don't have a no contact temperature measuring thingy. So we weren't able to do that. But we are taking our staff's temperatures and we're taking our own temperatures, monitoring that quite closely. But it is a normal, like a pediatric temperature thing. So we didn't want to use that for our patients. But yes, so any other comments, anything? Do you think that we're being completely ridiculous? Do you think we're completely over the top? Let's see what you guys think, and let's use this as an opportunity to learn and to, as a community, to figure out what is the best way forward. How are we supposed to be doing this? Thank you for listening, and we'll continue this conversation. See you guys soon.